Let's talk about miscarriage. And how do you know you are miscarrying? And what are the causes of miscarriage? So, miscarriage is the unexpected ending of pregnancy in the first 20 weeks. I'm talking about miscarriage. I'm not talking about abortion. So, know the difference. I'm saying a miscarriage is the unexpected ending of pregnancy, in the first 20 weeks of gestation. Just because it is called miscarriage, it doesn't mean you did something wrong in carrying the pregnancy. Most miscarriages are beyond your control and occurs because the fetus stopped growing or something has happened. Yeah. So that one you have to know. So we have different types of miscarriage. Your pregnancy are your pregnancy care provider may diagnose you with different types of miscarriage. So number one, we have missed miscarriage. So you haven't lost the pregnancy, but you are unaware it's happened. Did you get what I said? Missed miscarriage, you haven't lost the pregnancy, but you are unaware it happened. So there are no symptoms of miscarriage, but an ultrasound confirms the fetus has no heartbeat. It has just happened. You didn't have any signs. You did not bleed. It is only the ultrasound can reveal that you had a miscarriage without you knowing. And ultrasound will confirm if that you don't have the heartbeat. Yeah. We have another one that is called complete miscarriage. You have lost the pregnancy and your uterus is empty. You haven't experienced bleeding and past fetal tissue. Not you haven't, you have experienced bleeding and past fetal tissue, and this your care provider, health care provider will also confirm with the ultrasound that you had a complete miscarriage. This complete miscarriage, it just means that all the conception products has been expelled. Yeah, all the conception product has been expelled through the vagina. That is complete miscarriage. By the way, I heard somebody say that I lived with a dead fetus in my womb. I lived with a dead fetus in my womb. It means this person had a miscarriage, a missed miscarriage. This person had a missed miscarriage. This person did not realize that he had miscarried the baby. And I said miscarriage usually happen below 20 weeks and below. Yeah. So we have another one that is also called recurrent miscarriage. This, for you to be diagnosed with a recurrent miscarriage, it means that you have had more than 3 miscarriages. Yeah, you have had more than 3 miscarriages, and now we can say that you have recurrent miscarriage. You are somebody who is likely when she got the pregnancy, she can miscarry anytime. So when you are such, if the doctor stated that, then you have to take a lot of precaution when you get pregnant. We have another one that is called threatened miscarriage. Most usually happen to most of the women. Your cervix stay closed, and maybe you can have some spotting, or you just some spotting. You might also experience some pelvic cramping. Yeah, you might also experience some abdominal pain, some pelvic cramping, but the os is still closed. And also you can also experience some bleeding, not severe, some spotting, and threatened miscarriage can also lead to complete miscarriage. So if you experience that, you have to take a lot of precaution. You have to consult with your care provider so that you get intervention at the right time, so that you don't lose the baby. We have another one that is inevitable. It can't come back. It has already started, and the fetus and the products of conception must just come out. And this time, this type of miscarriage, you are really bleeding. You are just, how can I put that one? You are having a lot of hemorrhage with a lot of cramping of the abdomen and the pelvic area, and the cervix has started opening or dilating, and nothing can be done about it. Amniotic fluid is also leaking, and at this point it just have to come out. Yeah, this is also called inevitable miscarriage. Yes, those are some of. Another one is also called habitual miscarriage, where habitual means habit, from the word habit. You are somebody, if you just get pregnant, you have to miscarry. So maybe there is something wrong with you. You have to consult with the gynecologist so that you know the cause, or they prevent the cause. Yeah. Let me now talk, how do you know if you are miscarrying? How do you know that you are having a miscarriage? You may not be aware you are having a miscarriage. In people who have symptoms of miscarriage, the baby, the most common signs are bleeding. And sometimes you might not know. So you might just think that it is maybe a spotting that is always happen when maybe the fetus is getting implanted into the uterus, but it is not that. So the common signs are vaginal bleeding that progress from light to heavy. Yeah, you might have a light vaginal bleeding, and it progresses from light to heavy. You may also pass greenish tissue or blood clots. Yeah, you might also pass those things. You can have cramping and abdominal pain, and sometimes it can be worse than menstrual cramp. You can imagine. You can have lower back pain that may range from mild to severe, and also you can have a decrease in pregnancy symptoms. That's, yeah, the decrease in pregnancy symptoms. So contact your pregnancy care provider right away if you are experiencing the signs that I've stated. Make sure you contact or run to the hospital, or just go to the nearest hospital. even if it is at what time, even if it is at night, even if it is daytime, even if it is what, leave whatever you were doing, don't just go to the hospital, because you might lose the baby if you have those signs and you didn't go to the hospital. So the next point, what causes miscarriage? What causes miscarriage? We have something called chromosomal abnormality, which is about I think 50% of all miscarriages in the first trimester. That is up to 13 weeks of the pregnancy. So chromosomes are tiny structures inside the cell. Yeah, they are tiny structure inside the cells of your body that carry your genes. Genes determine all person's physical attributes, such as the assigned sex, hair, eye color, all those, the physical attributes of a person. Those are the genes determine that. So during fertilization, when the eggs and the sperms join, two sets of chromosomes came together. If an egg or a sperm has more or fewer chromosomes than normal, the fetus will have abnormal number. As an fertilized egg grows into a fetus, it is cells dividing and multiplying several times. So abnormalities during this process also lead to miscarriage. So most chromosomal problem occur by chance. It is not something that is usually occur. It just occur by chance, and then it cannot completely known why these chromosomal abnormalities occur. And this, just imagine, it covers 50% of all pregnancies in the first trimester. And most of those pregnancies, they are always there, the inevitable and the complete abortions or miscarriage. So apart from chromosomal abnormalities, we also have infection can cause miscarriage. Yeah, if infection can cause miscarriage. Exposures to some diseases also can cause miscarriage. Hormonal imbalance can cause miscarriage. Yeah, hormonal imbalance can cause miscarriage, and that one you have to know. Improper implantation of the fertilized egg in the uterus or in the lining of the uterus can cause miscarriage. How old are you can also cause miscarriage. If you are getting pregnant after 45 years, you are putting yourself at risk of getting miscarriage. Uterine abnormality can also cause miscarriage. Maybe you were somebody who was born with a uterus that is abnormal, that is not developed as it's supposed to develop. Then this abnormal uterus can also cause miscarriage. Incompetent cervix, especially if you're someone who usually do a lot of abortions, or maybe if you're just having an incompetent cervix, you can also have several abortions. So if you experience incompetent cervix, it usually has a solution. You can be done for a McDonald's stitch. They stitch the birth canal, The opening of the, not the birth canal and the cervix, they close the cervix. It is called the McDonald's stitch. And when you are about to give birth, then they will go and open it, or if you start having labor, they will open it. Lifestyle factors can also cause miscarriage. What do I mean? If you are somebody who usually drink a lot of alcohol when you're pregnant or just before you get pregnant, if you smoke during pregnancy or just before you get pregnant, you are putting yourself at risk of getting miscarriage. Some of the drugs also can cause miscarriage. Disorders of the immune system, like if you are having lupus as a disease, it can also cause miscarriage. If you are having severe kidney diseases, you can also have miscarriage. If you are having heart diseases, you are at risk of getting miscarriage. Diabetes that is not managed. If you are a patient with diabetes as a condition, and this diabetes that have not been managed before you get pregnant, or you are having gestational diabetes, also it can cause miscarriage. What else can cause miscarriage? Thyroid diseases can cause miscarriage. Radiation can cause miscarriage, and severe malnutrition also can cause miscarriage. If you're having anemia in pregnancy, you can have miscarriage. So there is no scientific proof that stress, exercise, sexual activities, or prolonged use of birth control or pill can cause miscarriage. Did you hear what I said? Note this statement. There is no scientific proof that stress, exercise, sexual activities, or prolonged use of birth control pills can cause miscarriage. Whatever your situation is, it is important to not blame yourself for having a miscarriage. Don't blame yourself. Sometimes it is a chromosomal disease. Abnormality is not disease. So most miscarriage have nothing to do with something you did. Not that. Most miscarriage have nothing to do with something that you did wrong. Yeah. So, okay, how painful is miscarriage? Miscarriage are different for every person, because you know you are losing a person. Some people have painful cramming, while other people have cramp, just mild cramping. So, and also this one depends with the type of miscarriage that you are having. Yeah, it depends with the type of miscarriage you are having, and I have nothing to say about that. So what happened first during a miscarriage? It is hard to say what happened first during a miscarriage, because everyone's symptoms are different. Sometimes there are no signs of miscarriage and you find out prenatal ultrasound that you have lost a pregnancy. Most people will experience some degree of cramping and bleeding, but what happened first varies. Maybe somebody who has experienced that is the one who is in a position who can tell us what happened first. But you know, sometimes even it is always hard for them to explain, because so what are the risk factors for a miscarriage? Okay, Risk factors, something that can put you at risk of getting miscarriage. That is what I mean by risk factors. Your age. Studies shows that the risk of miscarriage is about 12% to 15% for first people in their 20s, and rise about 25% for people by age 40. Most age-related miscarriage happen because chromosomal abnormality. Yeah. So the fetus has the fetus has missing or has an extra chromosome. And also another risk is previous miscarriages. Family history is another one. Health condition is another one. Yeah, those are some of the risk factors that can put you at risk of getting miscarriage. I think I can say some miscarriage are preventable. Yeah, some miscarriage are preventable, and you don't have to worry. And if you have if you are pregnant and you experience threatened miscarriage, you will stop a lot of activities. You might be restricted not to do exercise, or maybe not to have sexual intercourse when you're pregnant. So I think I've reached the end of this video. Thank you for watching this video. Let's meet in the next pregnancy series. Bye.